Hello, my name is Dr. Dewan as Raja. Today I will discuss about pharmacology of aspirin. Aspirin is an analgesic, it is a painkiller, it is an anti-inflammatory, so it works against inflammation, and it is also anti-platelet drug, so it prevents blood clot formation. Aspirin inhibits cyclooxygenase COX-1 and COX-2, and due to the inhibition of cyclooxygenase, arachidonic acid cannot be converted to prostaglandin, thromboxane, and prostacyclin. So how the anti-inflammatory action of aspirin? Aspirin inhibits inflammation in arthritis. There is pain in the joints. Prostaglandin is an important mediator of inflammation. Prostaglandin has homeostatic function and protects the lining epithelium of the gastrointestinal tract. So, if a person takes aspirin, he may have hemorrhage from the stomach. And aspirin is an anti-inflammatory drug because it inhibits the prostaglandin. Aspirin irreversibly inhibits cyclooxygenase, whereas inhibition produced by other NSAID is reversible. So this is the difference between the aspirin and other NSAID like ibuprofen, naproxen. So in case of aspirin, it irreversibly inhibits cyclooxygenase, whereas the inhibition produced by other NSAID is reversible. The irreversible action of aspirin results in a longer duration of its anti-platelet effect. Analgesic effect: peripheral inhibition of prostaglandin production, inhibition of pain stimuli at the subcortical level of the brain. Antipyretic effect: inhibition of interleukin-1 and interleukin-6, induce production of prostaglandin in the hypothalamus and the resetting of the thermoregulatory system, leading to vasodilation and heat loss. Okay, so it inhibits that interleukins and interleukin 6. Actions on platelets: thromboxane 2 enhances platelet aggregation. Aspirin can irreversibly inhibit thromboxane production in platelets. Thus, platelet aggregation is reduced, producing an anticoagulant effect with a prolonged bleeding time. So you got analgesic effect, antipyretic effect, antiplatelet effect. Okay. Now we'll go to the image here. Okay, this is taken from Kerjang and Trevor's Pharmacology Examination and Board Review 10th edition. Okay, what is our aspirin work? This is the acetylsalicylic acid or aspirin. This is one of the NSAIDs. It inhibits the cyclooxygenase enzyme, so the arachidonic acid cannot be converted into prostaglandin and thromboxane and prostacyclin. So there will be anti-inflammatory, analgesic, and antipyretic and antiplatelet function. Okay, action on the respiratory system. At therapeutic doses, aspirin stimulates the respiratory center and causes hyperventilation, that is increased rate of breathing, and respiratory alkalosis because of losing carbon dioxide. At toxic doses, aspirin paralyzes the respiratory center present in the brainstem and ensures respiratory acidosis. Action on the kidney. Prostaglandin increases the renal blood flow. Decreased synthesis of prostaglandin can result in retention of sodium and water and may cause edema and hyperkalemia. This is the actions of the aspirin on the kidney. Pharmacokinetics. Aspirin can be taken orally, applied topically on the skin, and can be used as a suppository to use in the rectum who cannot tolerate the oral medication. After oral administration, aspirin is absorbed through the stomach and small intestine, metabolized in the liver, and is excreted through the kidneys. Adverse effects of aspirin: epigastric distress, nausea, vomiting, gastrointestinal hemorrhage, prolonged bleeding time, respiratory depression and uncompensated respiratory and metabolic acidosis, hyperthermia, hypersensitivity in 15% cases, Ray's syndrome, that is hepatic encephalopathy, seen in children whose liver is not matured. If they take aspirin due to any reason, then they may go through Ray's syndrome. There is a problem of hepatocerebral syndrome. So problem in the liver damage, the toxic substance go to the brain. Okay, so we'll get Ray's syndrome, hepatocerebral syndrome. Okay, and drug interaction. Many drugs interact with aspirin, like that of thyroxine, triiodothyronine, phenytoin, and this addition of that may cause toxicity. And also antacid counter the action of the aspirin in the stomach. Okay, so many drugs has interaction with that of the aspirin. Okay, and that's all about the pharmacology of aspirin. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.